My bangs were not supposed to be this. My bangs were supposed to be nice little girls' bangs. My aunt, my uncle, my cousins, they came from New York. We were all going to a wedding. I cut my hair because I wanted bangs too. These girls had bangs. Why am I not having bangs? So then I ended up with my bangs all the way up here. So then they had to fill my eyebrows in with eye pencils. After that, I think that my eyebrows were on fleek because they grew back perfect. Always had a passion for dancing and very outgoing. At the age of 4, my parents decided to put me in classic dancing. And from there, I did it until I migrated at the age of 19.
12% of city residents are from Guyana, and that is out of 65,000 city residents. We did a study in the community to find out the prevalence of type 2 diabetes in the community. And through that study, we found that 30% of the Guyanese population had type 2 diabetes, compared to 15% of the non-Hispanic white population. The grant that we have is called Partnerships to Improve Community Health, or PITCH, and it's funded by the Centers for Disease Control and Prevention. Schenectady County is using it to improve community and clinical linkages to improve diabetes care. Tatiana's position was created specifically for the PITCH grant, and she is embedded right in the Family Health Center. So a big part of the work that Tatiana has been doing on this grant is to create a diabetes registry, which uses data pulled from the electronic medical record based on certain criteria of patients. And she uses the registry to really target who she is interacting with. Really having her right in the clinic and seeing her passion and knowledge about diabetes and how she can impact the system of care, but then also those individual patients, was really important for the grant.
I met Hema back in June of 2016. So after doing a chart review, I called Hema just to see where she was and what was the barrier going on.
That phone call that Tatiana made to say, Hema, why are you, she sounds so much like my mom. She said, Hema, why are you not coming to the doctor? There's where it started.
Hema then proceeded to tell me that she had been in the hospital with, very high blood sugar. She was hospitalized for a week. Then she got connected to health insurance, which was our charity care plan. After a while, Hema did not qualify for that anymore. And in the process, as Hema had that health insurance, it helped her to get her diabetes in control. And now Hema is again, I found Hema without her medications, without health insurance, and really trying to take care of herself.
We talk on the phone like we were friends for years. I feel so comfortable calling and say, Tatiana, this is going on. Tatiana, this is going on. Yeah. Tatiana, and she was always there to help. I want to focus on having a bariatric surgery done.
I'm very obese, and I've been trying, even with my diabetes, I've been trying with my diet also of losing weight. It's a very, very tough challenge. I've tried exercise, I've did everything I can, and I'm still doing it. I'm never gonna give up.
So what I did for Hema, I gave Hema the resources so she could apply for health insurance, which she qualified for it.
And Tatiana went right on it. She was like, this is a number, I'm gonna give you the call. She called me, she said, Hema, you're approved for the essential plan. And she said how much my payment will be every month and how much my visits would be.
I'm from Brazil, and the reason I wanted to, get into diabetes education was because, diabetes is a word that's pretty familiar for me since I was a child. My grandfather in Brazil passed away from the complications of diabetes. And, I learned here in the United States after I became a nurse, the importance of the education, which wasn't something available in my country.
And diabetes education has taught me a lot on how to control my blood sugars throughout the day, overnight, when to test it, when not to test it, what to eat, when should I eat that, what to cut off of my diet. For example, soda is
was one of the biggest challenge I had because I was so addicted to soda. Every so often I wanted a Pepsi. And I went from having a Pepsi to a Diet Pepsi to having no Pepsi at all.
And I relate so well with Hema's story too, because I have the same history. I know how Hema feels about, I've tried everything, I've tried all the diet, and sometimes there is the judgment, right? You're not doing the right job. And just like Hema, I also heard the diagnosis of diabetes, and it was many years of losing their weight and then feeling like a loser, basically, like it's a powerless. And I did bariatric surgery, and I am very happy with it. I took control of my health, and I understand where Hema is. We can relate too, because we are neighbors in country, and I know pretty much what is the health care in our country. That we're not looking at prevention, we are remediating. We only go to the doctor when we're sick. And so I can relate very well and help patients to understand their better ways of doing things, that the ways they are done in our country.
Well, Hema right now in her journey is, again, she's connected to care. It's still a long process because of the health insurance, a barrier, but I'm here to support Hema throughout until she meets her goal.
I know there is a lot more people out there who is in situations like I am. They're very reluctant about coming out and speaking about it because they don't know who to go to. I was fortunate to have Tatiana call me. I believe that there's people out there who really care, like Tatiana. She cares from within her heart. You can just hear it on the phone. And she was willing to help in every way possible.